Hey guys, welcome to another edition of the Living Day by Day show. We have made it, guys. We have made it to see another day, made it to see another week. I am your host, Lakiba Wallace, and I have an exciting show for you tonight, this morning, this evening. I don't know where you're watching or what time zone you might be watching on, but welcome again to the Living Day by Day show. And you're probably out there wondering, what is the Living Day by Day show all about? And why do I say that all the time? Because we always like to have the opportunity to welcome on our new listeners and our new viewers. So for those of you who are viewing and watching the very first time, the Living Day by Day show is a show that brings you an avenue of information, an avenue of education, and an avenue of information. So we inspire you, we inform you, and we educate you guys right here on the set of the Living Day by Day show. So we want you to take this time right now to Facebook somebody, tweet somebody, Instagram somebody, go live, do whatever you need to do, but let them know that we are live, guys, right here on the Living Day by Day show. I want to take just a few minutes to encourage you this evening, this afternoon, this morning, whatever time zone, again, that you may be in. I know these are hard times for a lot of people, but I want to encourage you today. I want to make sure that you keep your mind focused. Keep your mind on the Lord of Lords and the King of Kings, because no matter what you're going through and no matter what you're feeling like right now, you might have lost your job. You might be out of money. You might be trying to figure out, hey, they've reduced my salary at work. How am I going to make it? And I want to encourage you to tell you that you are going to make it in this season, no matter what it looks like. Continue to keep your eyes focused on God. And how do you do that? You're asking, how do I focus on God in such trying times? How do I focus on God when my back is against a wall? How do I focus on God when I no longer have that paycheck coming in every 2 weeks or every week or every day or whatever it might be? Definitely every day for those of you who were Uber drivers, those of you who were driving for Lyft, for those of you who might have been driving for Postmate. I know that that's a day-to-day income for you, but I'm encouraging you right now to let you know that God is still able to do all things but fail. And you got to have that in your spirit. You got to have God is able to do all things but fail in your spirit, because it's when you cannot do it anymore. That's when God really shows up. The Bible says it differently. When you are weak, that's when God shows himself strong. And so I want you to be strong and confident in your season of weakness. There's nothing wrong with feeling weak. There's nothing wrong with being in a season of weakness. Yes, I know we don't want to be in the season of weakness. No one wants to be in the season of weakness. We all want to be able to ride high. We all want to be able to be in a level of sufficiency. We all want to be in a level of abundance, and we all want to be in a level of elevation and a level of increase and a level of prosperity. But sometimes we do slip a little bit and we get into another place. Not slip meaning you've done something wrong. I'm certainly not using the word slip loosely, but sometimes we slip into another phase of our life. And that's exactly what it's called. It's just life. We go through things in our life, and we have to get to a point that we understand that there's phases of our life. There's highs, there's lows. That doesn't mean that God is not who he is in our high, and he's not who he is in our low. God is consistent. God is faithful. God he never changes. No matter where we are in our life, God is who he is. And so I'm just encouraging you all to, just keep the faith. Whatever you do, keep the faith in this season. And I want you to also be able to tap into the resources that are out there, dial 211 in your area. And that's a number where you can call and say, hey, I need some resources. What are the resources in my area? And you should be able to link on to those resources that are within your area. Again, this is not a time for you to fold. This is not a time for you to, throw in the towel. This is not a time for you to feel like, God has, forgotten about you, or God is just not showing up for you, because we know God, he is an on-time God. So I just want to encourage you all. We have an amazing show that is going to take place today, but most importantly, before we bring on Dr. Hassan, I wanted to just take some opportunity today to be able to encourage you guest. Y'all know I always do this show with two other hosts, but tonight we only have comedian Eric Elove Jordan, if I can get it out, who is going to be a part of the show tonight. And he will be coming on and he will be talking to you about some hot topics. We always like to dive into the different hot topics that are out there. But before we bring on Elove, before he comes into the Zoom room, that is, and be a part of the Living Day by Day show, I want to take some time to talk about the Living Day by Day magazine. I know y'all been seeing all the different people that have been a part of the Living Day by Day magazine. The cover has been amazing. And I tell you, if you think the previous covers have been amazing, then you have not seen nothing yet. You have not seen God put his super on my natural, because I promise you, the August 2020 edition of the Living Day by Day magazine is amazing, and I'm super excited. I'm super duper excited about it, because I'm just always excited, guys. You cannot go through stage 3 breast cancer, radiation, chemotherapy, multiple surgeries, and not be excited. I'm sorry. I don't need somebody to pat me on my back for me to be excited. I don't need another 6-figure check to come in the mail to be excited. I don't need a 6-figure deposit. That's good. That's real good if it comes. But I'm not sitting and waiting on those things to make me excited, because I'm excited that I have breath in my body. I'm excited that I am cancer free. I'm excited that I'm in good health. I'm excited that my children are living. I'm excited that my children are in good health. I'm excited that God thought enough to keep me on this earth, and I'm super duper excited about that. I owe God my entire life. When I say my entire life, I owe God my entire life. And so I'm just excited about that. And I want you to be excited about right where you are. Spend more time with God, pray to God, ask God to bring you out of whatever you're in. If you're in a situation of drought right now, God can bring on prosperity and abundance in your life. If you are in a place of sickness, we know God is a healer. God is able to heal you right where you are. No matter what your situation is, and I'm going to transition out of this, but I want to make sure I impress upon you today, this evening, this morning, to let you know that God is still on the throne. He's still a Lord of Lords and the King of Kings. Right now, guys, we are going to bring in comedian Elove Jordan to be a part of the Living Day by Day show. Y'all are in for an incredible treat. What's up, A? He is coming on. You know what? You know, every time we go live, he's always like, I'm like, wait a minute.
Oh, I'm trying to tell my kids be quiet.
He's like, shh, be quiet.
Yeah, my kids were talking to me. I'm like,
Oh my God, you just never know what's going to happen on the Living Day by Day show. But guys, we have a guest here. You know, our guest always chimes in right about 7:15. We're going to get into those hot topics as I talk about, but I want to go ahead and bring our guest on, and then we're going to kind of switch things a little bit, and then he is going to give you a lot of hot topics. So we're going to go ahead and bring in our guest for this evening. Or, you know, I keep saying this evening, I don't know where you are, guys. I'm in hot Atlanta. I am in.
it was hot today. It was extremely hot.
Yes, I am in hot Atlanta, and so I hope it's not cold where you are. You know, right here in Atlanta, Georgia, we call it the ATL, the A. It is hot, and so Eric is going to bring you those hot topics. But we want to go ahead and take the opportunity to invite an amazing young man to the Living Day by Day show, and that's none other than Dr. Hassan, who is a board-certified physiatrist, best-selling author, profitable practice coach, international speaker. Dr. Hassan, welcome to the Living Day by Day show.
Hey, thank you. I appreciate you guys having me on.
No, listen, I saw you in the chat room. I said, well, he's ready. I love it.
Listen, I can't be late.
Exactly. You know what? And that message to other people, because you know sometimes we in the messaging. Are you coming on the show? Like, you know, did you get the memo? Did you get the message? And so we appreciate you being prompt on this show. But, I just, talked about all the amazing things that you have, had the opportunity to develop into. But take some time just to tell the viewers and the listeners of the Living Day by Day show who Dr. Hassan, hopefully I pronounced that right, is.
Okay, I am Dr. Hassan, board certified physiatrist and independent practice owner. I help other physiatrists build and grow their own profitable practices so that they can achieve financial independence and live without limits. I was born and raised in Chicago, youngest of like 6 kids.
Wow.
And since I was little, I kind of always knew I wanted to be a physician. I was always fascinated by the mind and the body, and it just kind of made sense to try and be a doctor. So, I've been able to do some pretty nice things. I know my father, he's had 3 strokes or had 3 strokes before he passed away. But after his second one, they tried to send him to a nursing home. So I was able to fly him out to my rehab hospital in Arizona, take care of him. I've been able to pay off my student loans, just do some pretty nice things. But even in spite of all of that, I had a secret. So when I was in I believe it was my second year of undergrad, we were evicted. So we were homeless.
Wow.
And out of that experience, that kind of drove the passion for me to kind of help others be in a financial position where they don't have to worry about that. So that's me in a snapshot.
Well, that's a good snapshot, and we're gonna talk about student loans. We're gonna talk about the student loans on another show, because them student loans will creep up on you. You hear me?
Exactly.
Absolutely.
They got the creep. I am serious. So we need to have a conversation like, how do I get rid of these student loans? But this show is not about me today. And about all the other people out there who I'm sure like, my God, I gotta pay this student loan again. This is just too much. So, but welcome again to the Living Day by Day show. I am Lakiba Wallace, of course, and I do this show with celebrity comedian Eric E. Love Jordan, who is in the Zoom with us right now.
Nice.
But let's chat a little bit. COVID-19 is here, and there are a lot of dialogue going on about COVID-19. And so before we start talking about profits, what are your thoughts about COVID-19?
I think it's a very unfortunate situation in that a couple months before it kind of really hit us bad, we kind of, we're seeing it in other countries. And because this is such a global society, I don't think as a whole we really prepared ourselves for it. I think some governors and some hospital systems were very proactive. That's kind of one of the things that I try and do in my rehab hospital, and just in general say, hey, let's be proactive as opposed to reactive. But we weren't proactive enough to kind of set ourselves up for success. And as a result, you kind of see, especially in New York, a lot of the densely populated areas have been hit the hardest, just because it's very difficult to socially distance. And then as a physician or healer, like that doesn't, it just doesn't make sense for us to be distant from our patients. So you can kind of see how that situation kind of made it a very tough situation as a whole. And a lot of people are feeling the ill effects from it.
Awesome. So, now that we are post-COVID, I hate to say that because we know, we'll never be over COVID, but, we've been in this pandemic now since mid-March, and there's been a lot of conversation, a lot of research going on. Do you think clinically there is enough information out there about COVID?
Well, they keep saying the novel coronavirus, which really speaks to, we don't know a whole lot about it, but I think every day we learn more and more. I think if we just kind of take principles of other respiratory illnesses in terms of the precautions that we need to take, that's going to be a good start. But it's really about, the basics, good hand hygiene, and just taking care of yourself, maintaining a good distance, I think are good principles to kind of adhere to as we kind of open back up and kind of try and figure out what the new normal is.
Hmm. And I know I know you have some questions too, because you know what, I'll be writing my questions down. I got a whole list of questions, but go ahead.
Yeah. I just got a question for you, Doc. So how long did you take you to finish school? Or are you still in school?
So are we talking about undergrad included? Because it was 4 years of undergrad. After undergrad, I didn't immediately get into med school. I actually did a master's program in Indianapolis. So I did a year of that, then transitioned into medical school. That was 4 years. And then from medical school, then I went into residency. So, it's what, 16 years or close to
Wow.
that? Yeah.
My
So
God.
16 years of schooling.
Yeah.
Oh my God. That's why y'all doctors, y'all come out like, I am not put that position on the end of my name. MD, sir. That's a long time. Well, so what made you, because I know, when people, you talk about comedians or you talk about writers or even people that, whatever profession you're in, what made you have have that stick to it into this, if that's a word, for you to want to do it for that long to reach what you needed to become a doctor?
My father was Nigerian.
Okay.
Enough
So
said, right?
that's the
Enough
answer.
said.
Did your father say, you will finish, my son?
You will finish this for sure.
Oh. So were there any time in your career that you were tired? You said, I don't know if I want to finish this.
I love it.
Yeah, I mean, I think the process in general, like, if you haven't gone through it, it's tough. Like, it's mentally tough, physically tough. But thankfully for me, throughout my journey, I have really good people around me. So
Awesome.
I did undergrad at Xavier University. When I went, it was like #1 in placing African Americans into medical school.
Oh,
So
wow.
just being in that environment, you're
Mhm.
around like really intelligent, people who look like you, talk like you, have had a similar experience. And even if they don't go to the same school as you, you have that network to kind of tap into because they're kind of going through it at the same time. So that helped out a lot, being able to kind of tap into this network. Like, hey, I'm in biochem, I'm having a tough time with this. They'll kind of give you feedback or just say, hey, stick with it. You're smart, you can do this. So having that network really helped me out.
Wow.
Gotcha. Man.
I'm not even going to talk about my struggles with anatomy and physiology. You said biochem.
I know I had to take that as a dancer, you had to take that class. You had to take, all the different parts of the bone. And there's a bone with a dot on it. You got to know what that dot is. I'm like, man, I just want to be able to go 1, 2, 3, kick. Well, I got to know about the bones.
It was rough. It was rough, man. It was rough. Let's transition back into COVID-19. And before we start talking about, the platform that you really have. So do you think, and this is the question across the board, that COVID-19 is going to have an effect on the flu season coming up?
Oh, without a doubt. Absolutely. I was actually sitting down having a conversation with one of the infectious disease doctors who I'm close with. And, I said, hey, honestly, like, what do you think about flu season? He said, listen, I'm scared. I'm absolutely afraid. Because I think the big thing that we're missing is we're not doing testing. Like, it just makes sense. Like, and we're not doing, well, anyway, in my opinion, it's a particular test that we should do, but we're not testing everyone to figure out who actually has COVID-19 and who doesn't. And the people who do have it, who may be asymptomatic, you just kind of have them go away, quarantine for like 2 weeks, and you bring them back or retest them. That way you kind of are, for certain this individual has it versus this individual doesn't. And now you can kind of try and figure out what the new normal is and different things like that.
Right. So how do you think COVID-19 has affected hospitals, in particular, medical practices from a financial perspective?
Oh, it's had a huge negative impact on both hospitals and medical practices, from the standpoint that really in business, everything, healthcare is a business, everything is about volume. So when you enact a stay-at-home order where people can't go anywhere, or there's this sense of fear where people are afraid to go seek healthcare, now you lose that volume. And as a result of losing that volume, that adversely impacts your profits. So that has been a huge effect. And what happens is with physicians who are employed, especially some of your surgeons. So when a lot of the different states said, hey, you can't do these elective procedures, they weren't able to operate. So operations are one of the big drivers of revenue for hospitals, surgery centers. And if you can't do that, now there's this huge lack of revenue that's coming in, but you still have this high dollar employee. So as a business person or from a business standpoint, you want to cut costs. So there were situations where, prestigious surgeons or, certain surgeons were either furloughed or laid off. So it had a huge impact on the healthcare system and practitioners in general.
Wow. So now that part, we hear a lot of layoffs for, regular folks, if I can say that,
Right.
but I guess when you really think about it, I'm sure, physicians would have had to, at some level of, not being able to operate because, you
Right.
can't see the patients, which means you're not able to bill. But what about telehealth? What about those providers who have opted to do telehealth?
So the people who were doing telehealth or were able to quickly pivot to telehealth, they're ahead of the curve. Because what happened was, now this is the only way you can kind of see patients. People had to quickly move to that platform. If you were already doing it, now you got an influx of volume, like we talked about before, volume. So now you have more volume coming in. And for those people who were able to quickly adapt and get adjusted to it, they were able to kind of adjust and deal with that volume that was coming in. But I think a big thing that's going to come out of this is individuals get more comfortable with it. So anytime you have something new, it's the whole process of getting used to it. I think patients and families are going to say, hey, I kind of like this. So once things kind of settle, you're going to see telehealth as a platform that's utilized more. And for some patients, some family members, it's going to be great. But there are certain limitations to it. But all in all, I think that's going to be a platform that is going to have more prevalence as we move forward.
Okay,
Awesome.
I know you said something about, okay, you were a little afraid for the flu season that's coming. That's up and coming us. My daughter has this question for you, Doc. She's 9 years old,
Okay.
and her question
All
is
right.
this: if a person gets the flu around that time, will the test say they have COVID-19, or will it just say they have the flu?
So more than likely, they'll kind of have a battery of tests to test for each particular one, because they're actually doing that now, where they do the rapid flu, and then they also test for COVID-19. So they will have a test specifically for the flu versus COVID-19.
Gotcha. Okay, yeah, that was her burning question. She wanted to know that.
That was a good
Awesome.
question.
That was a good question. So what do you, and I agree with you, Dr. Hassan. I think, I'm an agent. I'm a real estate agent. Outside of being a media correspondent and a magazine editor, a lot of, I don't sell commercial. I'm glad I don't sell commercial, because I think right now commercial real estate is hurting, because a lot of, offices who were, in the nice, big buildings and suites, and there's going to be some rethinking about, do we need to have this $20,000 a month real estate bill hanging over our head when we've sent the majority of our, staff home, and now we're tapping into telehealth. I think it's going to change the game for a lot. Now, will there still be some providers who will go back to their practice and see patients the traditional way? Yeah, I think, we'll still have that, but I think there's going to be a high percentage of providers who can see telehealth and what this COVID-19 has made them do to survive, to become a new normal for them. Would you agree? Mhm.
Oh, absolutely, definitely. And I try and listen to the news and different things like that. Like, you're seeing it in the university space. Like, think about that. Think about how you gain knowledge and education. It's in this large lecture hall. You have all these people kind of bunched in together, listening to the professor. That's going to change. And then, okay, let's talk about sports. Like, we always think about, a sold out arena. That's going to look very different now.
Yeah.
Oh yeah.
When you mention that, I mean, right now the WWE is still, they're still wrestling, but they're doing it at their center where the wrestlers practice. And there's no people. It's just the wrestlers. They're in a small little ring, and it's like really, really weird. So, do you think now because of COVID? Because right now, I talked to somebody from the CDC, and they don't have no end date in sight whatsoever when this is going to take place. As far as like having a cure, like, do you feel like there's going to be a cure anytime soon, like in the year 2020? Or do we need to say 2020 is the year of the social distance and we need to focus on seeing each other, hugging and kissing people in 2021?
So I don't think there's going to be a cure just because, it's a viral illness. And then if you think about it, there's no money in the cure. But I don't think there's going to be a cure.
Bingo. Yahtzee.
I do think there's going to be a vaccine. My fear, though, is we get to the point where flu season rolls around, we have 14 vaccines that we have to take. But I do think they're going to develop a vaccine. But I think there's a way to kind of get through it. Like I said before, if you do a certain type of testing, you can figure out who has it versus who doesn't have it. And then the folks that have it, you kind of have them quarantined, and then everybody else should be okay for the most part. Because now you're identifying the quote-unquote asymptomatic carriers who, if they get it, they're okay. They don't necessarily get sick, but they can spread it to someone who's more vulnerable, who can get sick and potentially pass away. So I think those are kind of a couple options that we can take moving forward that can help us go back to some form of what we had before COVID-19.
So when is the flu season? So we can really start preparing for ourselves. Is it after summertime, like in September?
Yeah, it's like September. That's when it hits. Because that's when I have to wear my mask in the hospital. So it's like September to around, I think, March. Sometimes they may extend it, but yeah, that's kind of that season right there.
Wow. So, Dr. Hassan, you're definitely clinically well balanced, and we thank you for taking some time to just give us some more clinical information about COVID-19. But also, you're well balanced from a financial and profit standpoint as well. Being the bestseller, you have written a plethora of books, and so take us down that path of how does a doctor, say, I want to be an author? Take us down that lane, how you decided that you want to start writing, and then transition into why you're writing about profit for physicians.
And you better not say because your dad is because you're Nigerian. You better not say that. They cannot be the answer for everything, sir.
Right.
So, in terms of how I became an author, it was my business coach, Dr. Drayon Birch. He forced me to do it. But honestly, it kind of makes sense. It was always something that I thought about doing, but I never really knew that I can do it. But with his tutelage and pushing, I was able to get it done. And how I picked my particular topic, what happens is they teach us how to be these healers and help people out, but they don't teach us the business of medicine. And that hurts us. So when I was kind of figuring out what I was going to do after I left residency, I basically took that whole process and kind of put that in paper so that I could potentially put that out there for other residents or other physicians to use that as a framework so that they can do the same thing. Because my thought process is if physicians understand the business of medicine, we can take back medicine and actually perform medicine the way that we all envisioned when we were smaller. Because now, we don't have to worry about the finances because we already had that down. So that's kind of how that process came about.
Wow. And I'm not going to dive too deep into this, but I know what you're saying. It's spot on. There was an article years ago about this one particular hospital. I'm not going to get into the names. And this particular hospital and cardiologists were performing multiple catheterizations for patients who, and I'm sure you know, I'm not here to bash nobody's name, but I'm just piggybacking on what you are saying and bringing some light and truth to that. And they were just doing all these caths, and patients were coming in, didn't even need no catheterization whatsoever, but because there's dollars in that, it was going on. The hospital administrator was allowing it to go on. I know that because I have an MBA in healthcare administration, and it was something I studied. And they were just allowing all these cath, to go on, and until the patient died. Now, there was a particular nurse who was like, hey, this is wrong. We shouldn't be doing this. They fired the nurse. The nurse ended up getting a lawyer. And in the midst of the nurse getting a lawyer, the patient died, and then the hospital was exposed. I'm paraphrasing, but that's basically what happened. So I do understand. I don't agree with it, but I do understand that there are a lot of doctors who of course they care for patients. That's why you go to school. But then you got to survive. I mean, it's just like the restaurants that are shut down now. How do they survive? I mean, they survive by cooking all this good food, having all these, clients come in. But then from a doctor perspective, from a medical perspective, y'all survive by the number of patients that you're seeing, the number of procedures. Tell me if I'm right or wrong,
No, you're absolutely right in that. And I think what we have to do is we have to be smarter about how we do it. Because hospital systems will never pay us as much as we're worth in terms of how much we generate for the particular healthcare systems. Because you hear all these stories, or I listen to NPR. I'm a nerd, huge nerd. So they have a segment where they talk about people who basically got a surprise bill. And you'll hear them go through an itemized bill, like they're charging $25 for a little aspirin.
Yeah.
Like, and you can go to Walgreens and get like 10 of those things for $10. So,
right.
It's stuff like that. They use us to care for the patients, but they charge so much, so we have to understand our worth and our impact on the healthcare system and leverage that to change the system to actually make it more patient focused.
I love it. So do you think, of course there is the CARES Act. And for those of you who don't know what that is, that's the Coronavirus Aid, Relief, and Economic Security Act, which is providing $100 billion to providers and healthcare organizations. Do you think the CARES Act is going to be enough to help facilities and medical providers bounce back?
I think it's going to be tough. I don't think it's going to completely replace the revenue that healthcare systems and hospitals have lost, but it can kind of sort of stem the tide. I think the big thing that's going to help make up for that loss is really when things open up, like they're going to have to ramp up. So all these places that stop doing elective procedures, they have this large wait list. So they're going to have to address that wait list. But in doing that, now you're going to put a lot of stress on that system. So you're going to have to double book, rebook, overbook, ORs. You're going to have to get staff. So it's going to be a strain in terms of ramping things up to try and make up for that huge loss over 2 months or however long it was where they kind of shut things down. And I don't think you'll ever make up exactly how much you lost. But that can help kind of keep people afloat to a degree. And then when things open up, people are going to be busier, much busier, when people feel safe and comfortable to kind of start seeking out healthcare again.
Okay.
So
Go ahead.
I'm saying this is just the question I have because, with the politicians now, I know Bernie Sanders ran on the thing about, free healthcare. And I know some countries have like some type of free healthcare type of system. What is your take on what would it mean for free healthcare where you guys as physicians still can get paid, still get, because, you did these 16 years of schooling, you want to get paid for your services too, but you got people that, want free healthcare. So is there anything that could be done where everybody can get what they want?
So it's possible, but a lot of people have to make sacrifices. So you got to think about that. You have your large healthcare providers who are in the business of profiting off of healthcare. So they're going to push back. They have lobbyists. So you're going to have to deal with that first. And then in terms of, okay, once we get past that, a big thing that individuals don't necessarily realize is physicians come out of training with sometimes $500,000 in debt, right? So if you can come out of school free of debt, then if someone says, okay, we'll pay you this amount of money to be able to care for patients, that's a whole different ballgame, than saying, hey, listen, I would do it, but, I still got $500,000 in debt. I'm trying to buy a house. I'm trying to start a family. I'm still trying to take some vacations and relax when I do get some time off.
Real talk.
So, I think if we kind of address some of these issues, then it's a real possibility. But, that big behemoth, commercial healthcare, that's a lot that they're going to give up. Because I think I saw somebody posted somewhere that the different salaries for the CEOs of some of the big healthcare companies, like 15 million and different things like that, like they stand to lose a lot. And when people stand to lose a lot, they fight. So
yeah.
Awesome.
I thought that was just very interesting. I wanted to know what your take was on, and I never thought about that. It's like, hey, if we can help out the physicians and somehow, where they don't have to pay $18 billion, because coming back from school, I know that's what it feels like, like after you get all these student loans, like, man, I'm an MD, yay! Here's this student loan, and you can't defer it.
We're going to make you laugh on this show, Dr. Hassan, that is for sure.
So, Dr. Hassan, you should have gave them bills to your dad before you passed. Said, no, you told me to do this, man. Here, this for you. Pass it on to your auntie.
He came back and gave them back to me. He said, no, you took this.
Y'all are too much. But before we let you go, do you think that with everything that is, all the resources, the coronavirus acts, the CARES Act, all this different stuff that's going on out there, that we will see some level of hospitals and providers getting back to some level of normality?
Yeah, I think there's going to be a new normal. People are going to have to adjust. And like we talked about, different platforms are now going to take more precedence, like telehealth. So, they'll get back to it. It's going to look a little different, but I think, we can get back to a similar spot to a degree. Awesome.
And so since you're writing, you have a gazillion books. What's the next book that you are currently writing on now?
I think the next book is kind of more niche in terms of rehab medicine, kind of talking about the business of rehab. So, all the different rehab doctors. So now they set up their practice, the different ways on how they can maximize that practice and really have a huge impact in terms of the healthcare that's being provided, but also being able to, do okay from a financial standpoint.
I hear that. Well, it has truly been an honor just to have you be a guest on the Living Day by Day show. I want you to take some time and tell the viewers and the listeners how they can get in contact with you.
Oh, awesome. Thank you guys for having me. I appreciate you guys sitting there and listening to me talk. Folks, if they want to learn a little more about me or see more of me, you can follow me on social media at Dr. Hassan Rehab. DrHassanRehab.
Awesome. Well, thank you so much. And for that doctor out there who want to get rid of them student loans and you want to figure out how to run a more profitable business, we encourage you to make sure that you hit up with Dr. Hassan. Thank you so much again, Dr. Hassan, for being a guest right here on the Living Day by Day show.
All right. Thank you guys. I really appreciate it.
We appreciate you. Have a good day. Bye. My God, what a wealth of information, guys. I
Man.
tell you, Dr. Hassan, I mean, did you catch the student loans are paid
I
off?
know, right? Did you like my question? Did you
I
like
love
my
your question. Listen, we need. Hey, I'm gonna have to call him after this show to figure out how. He said $500,000. I only gotta compared to what I got is really nothing, but I want to get rid of it.
Right.
My God, what a well-rounded, educated young man, and we are honored to have Dr. Hassan be a guest. Let's get into them hot topics. See what you got.
Woo, yes, hot topics. Okay, so hot topic number one. Okay, we all know that the case of Mr. Arbery is going on. They did go ahead and arrest the two guys. Now, the current case right now is that, while people are upset trying to figure out why it took so long for these guys to make an arrest. Now, of course, news world is trying to spin it, and some right wing people are saying, well, they were justified to chase Mr. Arbery down because he actually entered into one of the properties in the area and was looking around. But the homeowner said, well, I didn't ask them to do that. I didn't ask them to chase nobody. I didn't ask them to look at anybody. And I didn't ask them to, at least chase nobody down. And so that's one of the things they're trying to make a spin on, saying, well, he had, a criminal record before. Okay.
Right.
There's so many people that have tickets.
Yes. And
that doesn't mean that he got to die, though. You know what I'm saying? Okay, granted, he enters on somebody's property, he don't supposed to be there. That's what? That's a ticket, or you go to jail, because if you stole something. If you take something off of the property, then you go to jail. He was looking around. We don't know why he was looking around. And now he's dead, we can't find out.
Right.
You don't even know why he went in there. He could have been like, you know what? I want to one day start doing construction. Ooh, construction site. Let me look around. How many people don't ever went into a building, been driving around, and they look at a building, they see it's open, they go inside, they look.
I've done that several times.
You know how many houses I done looked at and looked in that they were building just to get ideas and see what it looks like?
Yeah.
And that happens all the time. So
there is no justifying. There is no justifiable reason why they shot Ahmaud Arbery. I don't care who says what, and I was telling my sister a few days ago that, I was posting on social media about, justice for Arbery, and I've had a few hate messages on my Instagram, and of course I removed them. I'm not going to respond to it because I don't respond to stupidity, and I don't care what anybody say. And let's flip that. If this was a group of Black boys, or a Black father and a Black son, who did the exact same thing to a white boy, my whole,
they'll be dead.
They would be dead, but my whole stance would be the same. It would be the same. It's not the color. I'm not siding with Ahmaud and, his family because he's a Black boy. But the fact of the matter is that the way they killed him, I don't care if he was black, white, green, red, or whatever, was an injustice. Nobody deserves to have been treated that way, But you're right, E. If it was a Black father, the Black son who hunted and tracked down a white, they'd have been dead at the scene. It wouldn't have been no reason for a trial or anything like that. It'd have been SWAT out, and they'd have no questions, Yeah.
And then my whole thing is that if you didn't know me, Lakiba, all right, say you didn't know me, I'm white or black. The color doesn't matter. And you're jogging down the street, and you get up toward me, and I have a shotgun. Aren't you going to dart to the other side of the street?
Yeah, and that's what he did.
If I come toward you saying, come here, and look like I'm trying to stop you, I don't have no badge on. I don't know what they said to him. Aren't you going to try to defend yourself?
Absolutely. Something about to go down. I'm going to try to.
You're going to go down fighting. So, duh. And now, just moving and segue to the second part of my hot topic is right now, the person that videotaped all this is, he's getting a lot of flack and a lot of heat, like why he didn't come forth, because right now he's saying he's scared for his life. And he said, well, if you knew it was a tragedy, you knew it was wrong, as soon as it took place, why you didn't say something? Why did it get circulated around a bunch of people showing what happened before it was ever even told what was done? Because that's how it got leaked out by somebody. Right. That was like, this is not right. We don't need to be sharing this. And they leaked it.
So, and what about the legal officials who brushed it under the carpet? You didn't feel like, it was a
two
case.
Of them accused it. Yeah, two of them accused themselves. One of them said they were justified. The other one said, the lady, the cops were going to arrest them right on the spot. The cops said no. The DA person, prosecutor, she said no because he worked in her office.
Yeah.
And, with that good old boy mentality. And people don't say, well, why y'all keep bringing race into it? I mean, we have to be honest.
Yep.
If everything was on an equal footing and playing field in the justice system, I don't think race would be an issue. Right. But because it's not, and everybody's you got to be real and be realistic. A black person can't jog down the street, and you should be able to go in anyone's neighborhood unless it's a gated community. Now, I can't go running in Calabasas. It's a gated community. I ain't stupid.
Right.
I am going to get stopped because they're going to be like, how'd you get in here? But I should be able to go down in Brunswick, Georgia, park my car, jog in the neighborhood because I want to. It's not private. It's a public area. I should be able to jog anywhere I want to.
Right.
But because I'm African American, I ain't stupid to know if I do jog in that neighborhood, someone's going to call the cops unless I live there.
Pretty
Just
much.
know that's going to happen.
Yeah.
And I don't care who's listening to this, you don't believe that's going to take place. I dare you to go to a all neighborhood that people that don't look like you. Yeah. This don't have to do with black or white. Go to an area that's all Asian or all Italian and just start walking around and see if the cops don't come out of nowhere and ask you what you're doing over here.
Absolutely.
It's just guaranteed. That's almost like a white person that's not related to anybody, and they just pop up at a family reunion. You're going to be asked, who are you?
Yeah, real talk.
That's just life. And we got to understand that. And when people say they don't see color, they come out, that's stupid. I'm sorry. There's 2 black people on the screen right now. And if there's another person of another race, it'll be 2 black people in whatever race that is on the screen with us right now. There is color, and you got to understand, we got to recognize that. And when you recognize that, then you have to understand people from that are African-American are coming from a place where the justice system has never been our friend.
I agree.
You got people that have PSD, or what it was PSDT. I'm saying it wrong. I apologize to all my soldiers. That when they see a cop behind them, they can't even drive anymore.
Post-traumatic stress syndrome, PSD. Yeah, you got it.
When I get a cop behind me, I turn on Jesus and I slow down, even if I'm going the speed limit.
Yep.
I make sure the speed limit's on. I make sure I got the lights and doing everything I'm supposed to be doing. I'm checking my mirror, so if he sees me, I'm gonna listen to pictures because I see you.
That is so. That's another show right there, man. I'm telling you. Even I can just personally say, my sister and brother-in-law, lived in a very affluent area, and house was, well over $1 million, and they experienced a hate crime. Somebody got a pillowcase and sprayed "Get Out, Nigger," put some bricks in it, and threw it through the window. So race is, and we're going to transition here because we only have a couple minutes before the show is over, but it's unfortunate that in 2020 that we are still dealing with race. So I am openly and boldly saying that I support Ahmaud Arbery's family, and we here at the Living Day by Day show, we are behind his attorney and his family 100%.
Yeah, well, those are my hot topics. That's really the thing that's been going across the airways. And just one little small thing. Yeah, the hot new song of COVID for COVID-19. If you're not seeing the video of Kirk Franklin's, it was on Mother's Day.
I saw
Kirk
that.
Franklin, he had jacket with shorts on with his socks up, but his wife was singing, his daughter, then his wife, and I guess it was his wife's mother.
Yeah.
You know, and they were doing the
Michelle Obama. I love that.
Yeah, they were doing that.
Loved it.
But I like the fact that the violinists, they weren't playing, they had masks on.
Yeah.
But I'm Kurt, if you see this and you listening, your daughter, baby didn't have a mask on. I'm just gonna throw that out there.
Stop it.
Why that baby didn't have a mask on? They were outside. They were outside. They supposed to have the mask on. Cute baby though. Baby didn't have a mask on. So I'm just throwing that out there. And then they said it's airborne and you had the doors wide open. So now all this stuff is inside your house.
All right. Kirk Franklin, he ain't got no home training.
But he got the blood of Jesus and Michelle Obama book, so I think they okay.
They all right. Well, guys, we thank you so much for taking the opportunity to listen to another amazing, awesome, inspiring, informative show. That's the Living Day by Day show. Make sure you catch us, guys, every Thursday. It's going to be comedian Eric E. Love Jordan and Lakiba. We want to say thank you to Preacher Elder Brown, who had rocked with the Living Day by Day show for 5-6+ years.
Yeah.
And he will be back, but he is taking a sabbatical right now. So Preacher Elder Brown, we love you. We thank you so much for being the other host on the Living Day by Day show. But make sure you stop by, be a part, Zoom on in, come on, be our guest host, be in the Zoom room, be an audience member, be a Zoom member, and be a part of what we are doing right here on the set of the Living Day by Day show. Make sure you check out our website at livingdaybyday.net. If you want to book a comedian, a real good comedian, that's comedian E-Love Jordan. He is also doing Facebook Live, Instagram Live, anything that can be live, he will be up in it. So make sure you stop by, send me an email, stop by my website, do whatever you do so you can make sure that you get some laughter, because laughter does the body good. Until next time, guys, stop by livingdaybyday.net. We love you so good. Be blessed and be safe.
Peace.
Peace.